The future looks bleak for many non-governmental organizations relying on donor funds from the USAID. NGOs are concerned as the US funding supports HIV and AIDS programs. They say they are still waiting for formal guidance. The United States has since implemented a limited waiver to freeze foreign aid. In eThekwini municipality, which has the highest HIV rate in the province, some NGOs have shut down. Professor Salim Abdool-Karim says that the halting of funding has far-reaching consequences, which could also impact crucial HIV and AIDS research.
Impact is very significant, and it affects all parts of our society, and research is also impacted by this exercise. So USAID funds several research programs, and they fund them throughout Africa, including South Africa. In South Africa, I'm not aware of the entirety of what they fund, but there are two large programs that they fund that we are part of. One focuses on HIV vaccines, and the other is on new technologies for prevention in women. And both those programs have been put on a stop. So both those research efforts have now are no longer continuing. The irony, of course, is that the research that's being done is actually aiming to produce benefits that will be of benefit to the US as much as it is to every other country.
However, Abdool-Karim says South Africa has made significant strides in the treatment of HIV and AIDS patients, and that the country can continue with clinical trials without the assistance of the United States, albeit difficult to do so without additional funding.
I mean, I think the AIDS control program and AIDS treatment functions without the need for PEPFAR anyway, but PEPFAR makes it better. And what we will see is a program that's going to now not have certain things like the amount of data that's collected, or some of the circumcision programs, or some of the condom programs, or the LBGTI services. So we will see some of those services now disappearing. But the core of the AIDS treatment program, which is the treatment of around 6 million people in South Africa, that will stay intact.
Abdool-Karim has concerns for countries which are more dependent on the US for HIV and AIDS treatment, such as Mozambique and Malawi. He says this could set back strides made to curb the HIV and AIDS pandemic.
While the impact of the cuts in the funding will affect South Africa, but not in any drastic kind of way, the impact in countries like Malawi, Zambia, Mozambique is very significant. PEPFAR is the primary provider of AIDS treatment in many of those settings. And so those countries will really see quite a substantial impact. That impact will be less so in countries like Nigeria, Kenya, South Africa, who already have existing services, existing capabilities to procure the medications, to provide the lab tests.
An NGO in the heart of Durban, CBD, funded by the Global Fund, says it has already seen an influx of patients who have been receiving services from NGOs that have since closed their doors.
Which means right now we are coming to an end of a current grant, which for South Africa is already the second year of our NSP, or National Strategic Plan for HIV. So the question is, as we complete this grant on the 31st of March, what happens at midnight to the organizations right now that are holding the fort? Because while PEPFAR's funding might have been suspended, the ones that are supported by Global Fund and other donor agents are the ones that are keeping the doors open, and therefore people being able to access services, and also borrowing some of their staff to our main primary healthcare facilities. So I think that's the other main question that we are wanting to get clear answers to, insofar as what happens at midnight on the 31st of March when this grant comes to an end.
NGOs are now pinning their hopes that the halting of funds by the United States will be temporary and soon lifted. and that they can continue to provide services to the most affected and vulnerable communities. For SABC News, I am Jade Paulser in Durban.